Welcome to everyone who is here today. I do want to take a moment as we begin to say a big thank you to Dr. Cheryl Stewart for leading our July Lunch and Learn, and Dr. Angie Jackson for facilitating that Lunch and Learn in my absence. Thank you so much. Please go ahead, if you would, and introduce yourselves in the chat, who you are, where you are, your connection to Central. This is, of course, our third Thursday's Lunch and Learn, where the Central community, from students, faculty, staff, alums, donors, friends, gather to learn about scholarship, ministry, and personal interests. It is a lunch and learn, so you are invited to eat your lunch while we learn together, or whatever meal or snack it might be time for in the part of the world where you are right now. Today, we are very blessed to be joined by Reverend Dr. May Latt, who is Supplemental Professor of Hebrew Bible here at Central Seminary, and also serves as a metadata analyst for biblical studies and archaeology for the American Theological Library Association. And Dr. Latt is also the interim pastor at Milwaukee, Myanmar Christian Church. And Dr. Latt today brings us a very important topic for our world and very important topic for our Central community: current politics and COVID in Myanmar. So Dr. Latt, would you please join or lead us today?
Thank you so much for inviting me. When Jessica told me to present something, I was thinking about only the political situation in Burma and how American Baptist has been so good and then supporting for people in Burma, and then especially the refugees across borders and internally displaced people. But then in July, we had a COVID-19 Delta variant hit a lot. And I've been struggling with even my auntie died a few days ago. And I am sure that some of the people here might have some relatives in Burma as well, because I saw some Burmese names in here. So I put it two together, because in Burma, we cannot separate now these two issues because of political, and then this virus cannot control anymore. So I put these two together, and then I am going to present, and let's have a little talk. If you don't understand or you don't know anything, just ask me a question, and then you can just interrupt my PowerPoint anytime, and then just ask me your questions. So today I prepared that topic, politics and then COVID-19 health issues in Burma. I am going to share my PowerPoint from here. So current political and health issues in Burma, in Myanmar. I would like to present a little bit about our Burmese history, because when we heard 2021, February the 1st, when we heard about this coup d'etat in Burma, first of all, I was shocked. But if you ask all of my friends, they said they were not that shocked. So why was it? Because we have a history throughout my bring up life. So here, Burma received independence from Great Britain in 1948. 1948, January the 4th, we got the independence. We have only 14 years of handling this baby independence. In 1962, March 2nd, we got military coup d'etat by General Ne Win. So it's only 14 years. Then 1974, General Ne Win claimed from the military dictatorship to one-party system. and he formed socialism, and he became a president of that socialism. Then after 26 years of military dictatorship along the line, we had a big revolution led by the university students. At that time, I was 20 years old, and I was at the university, and I was in the university student movement, and I was a youth leader for the Burmese Baptist Convention Youth Department. So that happened because of the devaluation of the Burmese currency. They did it twice, and second time when they did it, people were already poor. But when they did it, all these economics, business people got hit, and then we couldn't handle anymore, and we had a big revolution. General Salmao took over, and we got another coup d'etat at that point, and formed State Law and Order Restoration Council, which announced the martial law for almost 2 years. We had 3 years of no school in Burma, no colleges, no elementary school, no high school, nothing, no school, no education at all. I was in the college final years and the final year, and then we closed down for 3 years, and it didn't open until 1991. In 1991, they opened our colleges for only 3 months, and we studied so hard, and we just finished our exam and we graduated. So that was happened in 1988. In 1999, Burma had so-called free multi-party election, which was the first time in almost 30 years. National League for Democracy, led by Aung San Suu Kyi, the daughter of General Aung San, won in election with 392 seats out of 492 seats at the parliament. But the military junta refused to transfer the power. So we never get that power at all for the people elected government. Then here is the history of 2000 and 2014. Before that, 2007, we have another revolution happen led by the Buddhist monk. We all know that it is a Saffron Revolution. I was in the United States already. Due to increase in the price of fuel, gasoline, 3 times higher than we used to pay. So economic hit again, the revolution happened. So government cracked down harshly for that revolution. And my uncle, who converted to Buddhist, he was meditating at the monastery, not monastery, at the pagoda, Shwedagon pagoda. He was accused that he was a leader to this Saffron Revolution, and he was put into jail for 3 months as a political prisoner. He died in 2018. But anyway, we had all these revolution and we suffered a lot and we survived. So some of my friends said they were not surprised it happened this year again. International reaction at that time happened to the Burmese military government, which is economic sanctions. So we've been living under economic sanctions against military government for such a long period of time. So right now, military dictatorships are talking that we can live with that sanction. For them, it's just like a normal life. But civilians actually suffered a lot under this economic sanctions. We have 2009 and 2012 under this military government. We have a lot of ethnic battles happen. Ethnic battles broke out in Shan State. And also Karen and Burmese military happened in my whole lifetime, these ethnic battles. Nobody really can handle with that. And then 2012, ethnic battles continue in Kachin state. And also, we all know that Rohingya Muslims and then in Rakhine state and military, Myanmar military. Because of that, we have a lot of refugees across the border, Burma and Bangladesh border. We know that we have a lot of Rohingya refugees. And inside the country, we have internally displaced people in Kachin state and also a lot of Karen state, and a lot of people ran away to border in Thailand too. So we have refugees and then internally displaced people, even before this 2021 hit. So 2010, Aung San Suu Kyi was released from the house arrest. The election was held in 2010, but the whole party boycotted and they didn't come into election. So of course, military government who switched like people government, they call it. Nobody really accepted, but they called it that way. They took over. But then 2012, we have a parliament, the election for the parliament happened. Then National League for Democracy, led by Aung San Suu Kyi, won 43 seats out of 45 vacant seats in parliament. 2015, election was held again on November 8, 2015. NLD, National League for Democracy Party, won as landslide victory and 86% of the seats in the parliament. So that NLT party become a huge and then took over a lot of the seat in there. However, what happened is that our government system was set up very complicated way. We call it power sharing. Civil government and military, 50-50 power sharing. So the civil government never can have a national security authority in civil government, which is led by the National League for Democracy. So this 50-50 power sharing is the Constitution of 2018. And we were holding that, and we didn't, a lot of public didn't like it, but we were having this problem. So 2020 election on November 8th, National League for Democracy also won a landslide victory. So we thought that we were kind of fine because from 2015 to 2020, 5 years of, we call it partially democracy because military was not under civilian government. That's why the Rohingya and military problem, the civil government could not really solve fairly at that point. So, but all these civilian students and Generation Z, we call it, they were happy to taste this partial democracy. And we were happy to get a lot of opening learning system, right? Religious discrimination was still there, but a lot of religious opening things were happening at that point. Only 5 years, our democracy lasted. And 2021, February the 1st, we had another round of coup d'etat. So let's talk about the refugees right now. 2009, ethnic battles between Kachin, Shanwa, and Myanmar military. We had more than 10,000 internally displaced people in Burma and also Karen people and Myanmar, Karen villages and Myanmar military. Between all these battles, we have 10,000 refugees in Burma and around the borders. 2012 ethnic battles between Kachin, Rohingya, and Myanmar military made more than 50,000 people became refugees and internally displaced people in Burma. From the 2012 to 2021, about 1 million people in Burma became refugees and IDPs people. Since 2021, February the 1st, after the coup d'etat, 2 million people added in IDPs, according to the United Nations Office for the Coordination of Human Affairs data. That was put out yesterday from the record that about 2 million added. So we have right now 3 million people running around in the country, also in the borderlands, and also became a refugee. Because of this coup d'etat, we have a political prisoners and also death tolls by their political violence. And we call it CDM. I know that everybody know about it already. This is, CDM is a civil disobedience movement. So August 18, 2021, which was yesterday, the Assistance Association of Political Prisoners, AAPP, reports 43,000 civilians are detained as a political prisoners. But of course, actual numbers can be way higher. More than 10,000 people were killed from January 1st to yesterday. Again, actual count can be much higher. So since February the 1st, civil disobedience movement has become stronger to protest the coup. And civil disobedience movement includes doctors, nurses, teachers, government workers, and also Generation Zs. When we talk about it, there's so many of them who are not really connected to government offices. For example, like street sellers, right? Street sellers joined the civil disobedience movement, and taxi drivers, they were really supporting the protesters, giving a ride home after protest. So all these people are included, and then it's stronger and stronger. However, this fight has been pretty long right now, since February 1st. So it's been like more than 6 months. And CDM is really hard to be strong without having any incomes. So people in United States across the globe were supporting that. Even I am sure that a lot of churches, my church collected CDM support money almost every month and supporting everywhere in Burma. So that's the thing that we've been doing in this time. And I like to talk about NUG, which is a National Union Government, and PDF is Public Defense Force, Public Defense Force. These two are together. 2020 election was a legitimate election. 54 million people voted for National League for Democracy. So these 54 million people are asking international community to support them, that their vote need to be counted. Their vote need to be, how should I say? Yeah, counted and considered valuable, right? Because they really went out to vote and they voted for that. Only one thing is that international communities need a little push for this national union government to be a government, because majority of the international communities are hesitate, which is really a government, right? So seriously, we have two big bodies going on to govern Burma, one is military dictators, and then the other one is legitimate election civil government. So some leaders of this National League for Democracy were detained, and some were relocated to secure places. Right now, even with all these difficulties, they still formed this national union government to lead 54 million people. So under NUG, we have a Pidu Defense Force was formed because we don't consider these military dictators as our legitimate military force anymore. We don't trust them, and we have enough violence. So that's why we have a Pidu Defense Force was already formed by the NUG. And ethnic armed forces, we have round about 80, like small armed force, small ethnic armed force were there too, round about 80. I'm not really sure the data of that. All these forces considered to be a armed force against the government. But right now, they really wanted to defend for their ethnic people. So we combine with ethnic armed forces and this PDF combined, and they form the little defense force for the public in every county, every state right now in Burma. On the top of this military coup d'etat, we are having another problem right now. This is, everyone know, COVID Delta. Healthcare workers and medical doctors, medical personnel, all would join CDM movement. They are the first group when CDM, civil disobedience movement, was formed. They are the very first group joined this CDM movement. So they quit going to the hospital, but they opened their home to give treatment. And also they follow the protesters, and whoever gets shot, they just took them out, and they have a truck with all these medical equipment, and they just treated them. And they were so good to provide the medical care to the public. However, when the COVID Delta hit in July, people really wanted to take the COVID patient to the hospital, but then there's no doctors at the hospitals. So military dictators went around to arrest these doctors who joined the CDM and put them in jail. That's another problem happened. Not only that, they shut down the oxygen factories. 2 oxygen factories in my neighborhood were shut down. And also the pharmacies, they shut down the pharmacies too. So COVID Delta hit pretty bad. And then in July, the death toll, I couldn't even count anymore, because it's like every single day we have 2,000, 3,000 death toll is rising in Chin State especially, and in Rangoon, the main area. Right now, Chin State and Rangoon, the death tolls are going down. However, any other, like Mandalay, who is the second capital, and also like Dien Unui, all these little areas become huge hit now. So humanitarian aid. When I talk about refugees, 1 million and added up 2 million, add up, now 3 million people in Burma need humanitarian aid, according to UNOCHA aid. So yesterday I had an opportunity to attend with the UN rapporteur, Tom Andrews. He held a meeting and I get the opportunity to attend that meeting. Humanitarian aid, it's they were doing a lot, but we need to do more. We need to raise our voice for UN to provide this humanitarian aid. So I am going to let you know in the last slides that how Central can support all these things. Right now, let's continue on our little slide. So for COVID-19, there is no national vaccination plan yet. There are many different types of vaccination available in Burma. Pfizer, Moderna, Johnson & Johnson's, and we call it Covishield is from India. And our military dictators are tied up with Chinese government. So we get a lot of Chinese vaccine came in. However, civilians are scared to have this Chinese vaccine under military because they are not sure that how much they can trust. So they try not to take vaccine because Pfizer, Moderna, Johnson & Johnson's, and also AstraZeneca's, those are very, very expensive. Only people who have money can afford it. So only the handful of rich people can afford it. Chinese vaccine is very, very cheap and available, but people try not to get it. So death toll is still raising right now. Family and villages. Yesterday, we heard it from the meeting that Dr. Bennett, who is really working with the grassroots people. She was explaining that families in villages do not even have thermometers. So when they got sick, they didn't know, some of them didn't even say that they have a fever. And they just pretended like they don't have a fever because they don't have thermometers. And oxygen monitors, they don't have it. So they don't think that their oxygen level was low. And no emergency medicines. For example, like paracetamol, which is, we have been, all these Asian people know that we rely on paracetamol just like Tylenol. It is good to have it for their flu. The families in villages don't have even basic medicine, emergency medicines right now. Today, I talked to someone in the Unui area, and when I talked to her, she said, in their area, when they go around and ask, the people who ask them is, we just need rice. They don't even have food, so they don't consider medicine is important. Medicine is emergency. They don't think about it at all because they need food. So this is the thing happening in Burma right now. In Chin State alone in July, about 150 pastors had died by COVID. I am sure that in Central, there's so many Chin students, and you can even ask them that they can explain it to you more than me. By military violence, 16,000 Chin refugees fled to Mizoram state in India. Right now, Indian government is reluctant to host these refugees ran away from Burma, and they consider that they're going to send them home. So that's a problem happening right now. If they send them home, their life is not safe at all, secure at all in Burma right now. And then all kinds of COVID added. So right now they are still holding in Mizoram state in India. So here is the last slide that I want to explain, tell you, and then you can ask me a question, and then we will continue from the question and answer. How can CBDS support? Of course, since we are Christian, I ask you to pray for us, people in Burma, to have NUG, National Union Government, to be our government. And PDF, People Defense Force, People Defense Force to be our army. People Defense Force is in every county, every state, but they join the big army together. So we wanted them to be our army approved by the UN. Still, nothing is really settled yet. To have systematic national vaccination program, because our vaccination program right now is very chaotic. I couldn't even tell you how chaotic it is. Some people got it, some people don't get it, some people got it and they don't even know when there's going to be a second dose, things like that. So to reduce the death toll of COVID and the military, Myanmar military, or Myanmar military violence. So please pray for all these things. And if you want to support humanitarian aid, I am sure that you know Florence Lee and then Leslie Tully from ABHMS, American Baptist Home Mission Society. You can contact them. And they have a lot of resources that how to support this humanitarian aid. This is the last thing that I ask everyone whenever I talk to, whoever I talk to, whichever school I talk to, because this is really helpful. I mean, helpful, even like Tom Andrews yesterday, he said that don't think that it is not helpful. It is really helpful. You can also send email to your congresspersons in your state or senators in your own state to help Burma. Tom Andrews, UN Special Rapporteur for Human Rights in Burma, encourages us to press Congress about these issues. And he said this is a partisan issue. That's why please press them regarding the coup in Burma. Number one, you have to press for arms embargo. Number two, more economic sanctions. Right now, they are talking about economic sanctions are targeting the natural gas line in Burma, because that natural gas line is done by the China government, but majority, most of the money go to military content. So this is the one that we have to press to the Congress, economic sanctions more and more, because this administration in United States did the economic sanctions. The first round was really effective. It's targeted only to the military contact and all these people who connected to this military. So this is really helpful. So that is why we can press more on that. And if you can ask to raise humanitarian aid, you can ask for that too. Please press for that. Because when we think about humanitarian aid, it used to be for the refugees in other countries, like in India, in Malaysia, in Thailand, Rohingya in there. Not internally displaced people. Right now, refugees are in Burma with running around everywhere in Burma. So we have to ask to raise humanitarian aid. The last one, Tom Andrews said, this is the one that UN can independently do. Bring COVID-19 vaccine into Burma and have a systematic vaccination program in Burma. He said UN can do that alone without consulting any 41 countries cooperated with this. For the economic sanctions, 41 countries need to get together to push these things going. But bringing COVID-19 vaccine to Burma, UN can do it alone. But we have to write to senators and congresspersons. If you really want to help, please write even like little notes to them. I used to say like, do it once a week. I even suggest my church member, I wrote the letter and then send it to them and they just sign it and send it to the congressperson. With this COVID-19, I have a lot of deaths going on and then having a lot of worship service. I really, I can do such limited things. So I couldn't do it so much right now. So if you can support this, that would be great. Questions? And I'm going to stop sharing this. And then if you have any questions, I am sure that there's so many from my country also jump in and talk about whatever I missed here. I saw that Notablumu and Sanko, they can also contribute my presentation as well. Now I just want to ask you, are you all depressed by hearing? I'm sorry.
I have a question, Dr. Latt. I think you have given us some very helpful things to communicate to our Congress people. And so it sounds like those are what you would feel would be helpful. But I think the international community has really been struggling as to what can actually be done to be helpful. I mean, initially the movement, nonviolent movement, was so impressive about what people were doing in opposing the military, and it's just been such a difficult struggle. But as we are now like exiting from Afghanistan after actually going in as a military 20 years ago, military intervention, good idea, the people of Myanmar. So are there any other thoughts you have about what the international community should be doing to help the people? Or are the arms embargo and the economic sanctions to military, are those the primary things in terms of helping the military situation?
When we started asking before, right, we also asked for like limiting the air, how do you call it, that area section that when protesters come and then they really fight from the airplane and they just bomb them and things like that. We asked all kinds of things. Somehow after COVID hit, that thing is a little bit reduced, but we are still asking for that. For international communities, yesterday when we talk about it, we asked mainly these two things, that targeted economic sanctions. Because when we talk about economic sanctions, most of the time, civilians got hit a lot for our lifetime. We the one who struggle. However, the targeted economic sanctions is really helpful. Right now, basically targeted to this gasoline enterprise. If we targeted that one, that would be good. And of course, arm embargo. When we ask arm embargo for the military, but in the meantime, PDF, People Defense Force, needed some arms, but they cannot really hold any arms legally because NUG itself was not accepted by the international community. So number one is please accept NUG as our government. So we are pushing that National Union government need to be our government because they're the one, it was formed under this National League for Democracy party with the leaders. But this government is not only from the National League for Democracy, all these ethnic people also involved too. So once National Union government was accepted as a government by the international communities, I think 88% of Burma might be a bit settled and then, legitimate by the whole world. So NUG to be a government, that's the one that we are pressing mainly right now.
Dr. Latt, there are a couple questions in the chat here. One is, do you think that this is getting enough attention in the world?
Do I think that this is, where is that? Do I think that it is getting enough attention in the world? We thought we got enough attention before, right? In February 1st, and that it came up, we got pretty good attention. But we all worry that people become less and less paying attention because it's been pretty long now, right? And the Burmese, as a dictatorship, they don't care. They don't care. Whatever the international community said, they don't care. So what can we do? We can do is we have to push this national union government. 1988 and 2021 is very different. 1988, when we had a revolution, military took over, but we didn't have other governing body aside from socialism, Right now, we have our own democratic party, 50-50 power, and this thing happened. So national union government is the legitimate government. So we don't want the world to it's going to be like that. No, we want more attention. I wish that the attention is not going to go down and we got more attention. That's the thing that we are hoping. And I'm so thankful that CBDS is interesting in that and calling me to speak, because I haven't spoke like that for pretty long, since I could say in June. So June, July, 2 months already. I didn't talk about anything anywhere at all. So.
Thank you. Another question in the chat was around who might be most at risk. Frontline workers, healthcare, educators, children, the elderly, migrant workers.
For the COVID hit, majority died are all elderly people. All elderly people. All of my mom's best friends who are 80s, all gone. Even today, my neighbors who is 79, he died just today. So elderly people get hit the most, and they didn't have a vaccine. So this is the most hit by the COVID-19. Healthcare worker got the most hit by military, because even at the beginning, they started catching doctors and nurses who are helping volunteering to the people get violence by the military. And they went around and they arrested them and they put them in the jail. The sad story I have is my friend who is the nurse practitioner, that the highest rank in one of the Christian clinic. She was helping CDM movement. And in her house, the second wave of COVID-19, she cleaned up the whole clinic, 3-storage clinic. She cleaned it up. And a lot of people got saved from that COVID second wave. In that third wave, she was ready. But the military came and arrested her and put her in jail. She got COVID and she came out with COVID, then she died. After 2 days, they released her. So these things happening day after day. So healthcare workers, doctors, nurses, all sorts of the healthcare workers were hit by the military, the most hit by the military. So when we think about it, This is happening in Burma, healthcare workers, elderly people who are suffering with health. On the top of military, this COVID is hitting that. Not educators, because educators, some of them just stay home because schools closed, and CDM movement educators were in there, and then right now school cannot open because of the COVID. So educators are kind of like not that much risk for these things. Yeah. Okay, another thing about the migrant and the refugees area, we thought COVID-19 hit might be bad in the refugee area. When I thought about it, I asked internally displaced people. There's 40 people are in one of the churches that our church supported that group in Kachin, Lashu, in Lashu. They said they didn't have anybody in there, but so far they didn't find it yet. I am worried, and I'm still praying for that nobody find any virus in there, because 40 people are together, and it's so hard to give the mask because they don't have enough masks. So they keep on wearing the same mask. And then because of the weather so hard, these people are so hard to tell, please wear masks, please. They don't want to. Still right now, nobody is getting COVID yet. If one person get it, it is so easy to spread these 40 people at the church together. So hopefully we don't have this problem in that internally displaced people. They run around because the military came by their village, and the whole village was in that church. So please pray for that. What is the situation with NGOs being able to help? NGOs, they are being able to help before. They were being able to help before. My auntie, Dr. May Latt, she is the executive director of the whole NGOs group. So when we raise money, we send it to her, and she sent it to all across NGOs. So it supported a lot of people. Somehow she got hit by COVID, and she is still alive, thankfully, because the money goes into her house. A lot of NGOs group come in and got money. So what she thought is that she got COVID from money. What we thought is like a lot of people are in and out of her house. So a lot of people can carry this disease. The NGOs really can help this thing. But right now we have a problem with the bank, and we have a problem with, if I have to tell you, there's so many problems, right? You don't want to go home with a problem in your mind, but we have a problem with the bank, and we have problem with how much money that we can distribute to NGO group. There's a lot of NGO and a lot of people are raising money and supporting that. I don't know any other like little group, but a lot of churches are also supporting that too. It is anything that you can help is a big help now. NGO is a big help too. Everything is a big help in Burma right now. Yeah.
Dr. Latt, I have a question. I really appreciated the history that you gave that led up to what happened in February. I'm wondering if there were any other situations where the results of the election were called into question, or if this was kind of the first time that has happened since elections.
You know, what should I say? In 1989, right? We had an election that's the worst one ever. Right now it's worse because of, right now it's the worst one. But before the 1989, we had an election, and the National League for Democracy won, never transferred the power at all. And what happened with our vote, right? But this time, people get out to protest. people are not going to back up. They're going to fight until we win. So this is the worst ever. One thing is that we already got the taste of democracy. You know, in Burma, majority, I went home since 2009, 2010, 2011, 12. I saw that a lot of things opened it up. When I went home last time, I even said, you know, transportation system in Burma became so much better. I didn't take the taxi anymore. I just took the public transportation with air conditioning. Oh my gosh, that's amazing. You even have to wear your blanket. And we were so happy. It's not like United States, but still improved like so much. People are catching up, education, electronic, all kinds of things that catching up. So this is the worst time because the country is going downhill, like all the way down. Plus with COVID. We had COVID, we have military, but then COVID Delta. So it's completely going downhill. So this is the worst.
I think we have time for the last question that was just put into the chat.
Yeah.
Yeah, go ahead.
Okay. This military hunter said it's going to last 1 year, but he announced it a week before. This is going to be 3 years term. And after 3 years, we're going to have an election again. So we don't trust the dictator because it's a dictatorship, you know, it's for the certain period of time. It lasts 26 years. It lasted another 24 years. And right now it's 1 year to 3 years and nobody trusted this dictator anymore because we have enough. So not 1 year for social. And are they going to back down? No, not at all. They don't. Unless somebody go and catch them, right? They won't back down. I talked to someone who is an education leader in Burma. And what do you think that the schools are going to open? And she said she doesn't think the school can be open unless this military is going to back down. Because military were already had the station in all these colleges. Who wants to go and attend the college? The college students, the Generation Z is the leader of these movements. No one wants to go and attend the colleges and university. So military won't back down for social. They never back down in our life. So this is another thing that we need the international community's help. We need international community to accept NUG so that NUG and international community can work together to make the country not going up, just settle a little bit again. We are hoping in that way.
Thank you so much, Dr. Latt. We're so grateful for the information you have brought to us today, your wisdom and the history, the things that we have learned, but also the call to action for us as individuals and for the institutions and communities that we are part of. So we're so grateful for you. I just have one quick announcement, and then I've asked if Dr. Ruth Roselle would close us in a prayer for the people of Myanmar. Before that time, though, the announcement is that we will not have a lunch and learn in September, but please mark your calendars to join us for the third Thursday in October, which is October 21st, when our president, Dr. Pam Durso, will present on her recent research on the experiences of clergy women. So that's the third Thursday of October, the 21st at noon Central Time. And now, Dr. Ruth Roselle, would you please lead us in a prayer?
Please pray with me. Our gracious God, we are grateful for this time together and so grateful for Dr. Latt and her knowledge and her sharing with us so that we can better understand the situation in Myanmar and also the things that we can do. We do pray for the people as their suffering is very, very great at this time as they experience political oppression, terror, sickness, lack of health care and food and so much else. We just pray that you'll be working with them to strengthen them. Thank you for their resourcefulness. But we do pray that the international community and each one of us as well would be responsive to what the needs are. We lift up in prayer the concerns that have been mentioned, that the national unity government would be accepted as the government of Myanmar, to be worked with the international community, that there would be arms embargo, that there would be targeted economic sanctions and more humanitarian aid. And we look to you to work within this situation and call to mind stories of the scriptures that talk about pretty hopeless situations or very difficult situations of oppression as well. Enslaved people in Egypt escaping to a promised land, the Israelite people at the time of Esther and intervention through her bravery in unexpected ways. And so we do pray that your spirit would somehow be working to bring about the relief of suffering and the freedom from oppression for these people. We pray all of this in Christ's name. Amen.
Thank you for having me.
Thank you so much for being here with us. Thanks to all of you for being here, and let us join in our continued prayers, both those spoken as well as those of action for the people of Myanmar. Thank you. Have a great day and stay safe and healthy, everyone.
Thank you, Dr. Latt.
Thank you.